All right, you guys, today we'll be assessing the head, lymph nodes, and thyroid of our patient here. For patient privacy, this is going to be Mr. B. Before I start my assessment, I will do some hand hygiene, and then I'm going to provide some patient privacy here. So to start off, we're going to start with our head assessment. So looking over here, we want to assess our patient's head for any lumps, bumps, any tenderness, maybe open sores or wounds on the head. So I'm going to go ahead and feel around your head if that's okay. So we're just looking here. I would have Mr. B get down on a shorter chair if I had one available to really assess his scalp as well. Any lumps, bumps, or tenderness here?
No.
Good, all right, looking good. Next, I'm going to assess your sinuses. So we'll do your frontal and maxillary sinuses. For sinuses, we're also assessing for pain, tenderness, and even some swelling. Are you having any pain in your frontal sinuses?
No.
Good. How about our maxillary?
No.
Perfect. All right, then we're going to move on to our cervical lymph nodes. So sir, I'm just going to be palpating various areas of your face and head. For our lymph node assessment, we're going to be using the pads of our fingers and just kind of in a circular motion. We want to be assessing for pain, tenderness. We want to see that our lymph nodes are mobile. If they are palpable, we don't want lymph nodes to be hard, fixed, or cause any pain. All right, so I'm going to start off with our occipital. You can look down a little bit for me. On the back of the head here, there we go. All right, we're going to do post-auricular. We'll do pre-auricular. We're going to do tonsillar. You have a patient with a thick beard, you have to get a little bit more deep. All right, we're going to do submandibular. Put your neck down a little bit more. There you go. Submandibular, right? And then submental at the tip of our chin. All right, now we're going to do posterior cervical, so just look straight ahead. Okay, and we'll do anterior cervical. Now we'll do deep cervical, one side at a time. So turn your head to the side. So deep cervical. And other side. Good, now we're gonna do supraclavicular. So I'll kind of have, yes, go like that. And I'm gonna be taking the pads of my fingers and kind of moving along the side here, like so. Any pain or tenderness in any of your lymph nodes?
No.
All right, perfect. Then we're going to go ahead and assess our thyroid. So the thyroid is a gland that sits right below your Adam's apple. So for this, I'm going to go behind my client. To stand up here. So to assess the thyroid, you're going to get behind your client and then bring your arms around. I'm going to be touching your neck, okay? Come around. You'll kind of feel for an Adam's apple, and then right below, your thyroid should be symmetrical on both sides. So what I'm going to have you do, sir, is look down and to the right and take a swallow. And then look down and to the left and take a swallow. So we want our thyroid gland to be symmetrical. We don't want to feel any nodes, any nodules, any pain or tenderness.
No.
No? Okay. Perfect. And so far that feels good. Next we're going to assess use our ophthalmoscope and otoscope. Our clinic here does not unfortunately keep them on hand, so I will be using our handy dandy ophthalmoscope and otoscope make believe. So normally an otoscope, ophthalmoscope have different connections. So for this, I would turn I'm going to use the ophthalmoscope first, which is going to assess our eyes. I would turn that on, kind of twist it open, and it shines a light. All right, and so this first one I'm going to be used to assess my patient's eyes. I use an ophthalmoscope to kind of look at the red reflex of our eyes. So we want to see an equal red reflex in both eyes. So I'm going to shine my light up. Good. I do see a red reflex in both eyes. If you only saw it in one, or if you didn't see it all, that would be a problem. Then we're going to move on to our otoscope for our ears. We'll use this side. Our ears, we would use a different connection. We'd twist this one off, twist a different one on top. The otoscope, we would put a plastic covering between patients. So for adults, I'm going to pull my pinna up and out and look inside. I would be able to see our tympanic membrane. It should be gray, pearly, and translucent. We don't want to see a red tympanic membrane, bulging, or anything that doesn't look like that. So that's it for our head and neck cervical assessment.